Hi, I'm Terrence Kommal. I lead businesses in South Africa, both for-profit and non-profit, and contribute primarily in the space of healthcare. South Africa is in a current transition phase in which the very strong and heavily burdened public healthcare system and the very strong and effective private healthcare system are at a crossroads in which government is developing and actively pursuing a national health insurance. Now, when we talk about universal health coverage, firstly, it fits strongly in a passion area that I work in, is the United Nations Sustainable Development Goal 3 in the area of healthcare. But when we talk universal health coverage, what does that encompass? To me, it's about creating universal access, it's about creating universal opportunities, about equitable distribution of resources and equitable distribution of skills across the environment so that all of the people in the country have access to these resources, these facilities, these treatments and these professionals in a timely, efficient and cost-effective manner. By creating a national health insurance, government's target is to create a focused, centralized managed system in which equitable, demand-controlled system will work. I may have a slightly different view on how that may operate, but I think in principle, South Africa is focusing on creating that universal health coverage whilst it already has a two-tiered system, a very two-tiered system, because you've got tertiary systems in which you have world-class leading healthcare systems, and you have very primitive healthcare systems in the public health system, which are extremely overburdened in very rural environments. So you have almost a first world and a third world system working in the same vertical of healthcare. And then you've got in parallel to that the private healthcare system in which people have access to general practitioners for basic consultations and other healthcare practitioners. And then you have access to some of the best collaborative systems and super specialty facilities in which you can go for a range of treatments and services, but those are strongly funded by medical aids. What government is trying to say is we need to find a system in which everyone has access to all of the services in an efficient, centrally managed system. But when we talk about universal health coverage, it's not a South African need, it's not an African need, it's a world need. Because when I spend time in the US and other healthcare systems in Cuba through last year, we start to realize that not every healthcare system has an effective public health system and a public health system. Some systems just have one system in which you either have insurance or you don't. And some countries like Cuba and South Africa have very strong public systems in which whether you have funds or not, you have access to a public system. But with having access to a public system that is at a minimal or no fee, there's a burden of having to wait for the specific services like transfusions and transplants and complex treatments, but basic services are directly available. So it's about finding the balance between that access and the private system. The different countries, the developed world and the developing world, and within one country like South Africa, in which you have a disparity between a first world and third world needs and solutions. So is universal health coverage a necessity? Yes, it is. Do we need to work collaboratively for solutions? I strongly agree. Because in conversations like we're having currently in Davos, it's not about what South Africa is doing. It's not about Africa. It's about what are we doing as a world? What are we doing as a world of people working with solutions? I had great conversations with some of my peers here out in YPO and other business environments who are working with amazing solutions which they provide from various countries, transatlantic and internationally, in a real-time environment, using amazing AI and machine learning technologies. And I want to take those conversations back to our ministries, to our peers in South Africa and say, maybe we need to start looking at adding some of these solutions, or at least having conversations with those implementing these solutions as a part of our bigger solution in providing healthcare for all in South Africa and in terms of finding solutions for the rest of the developing world so that we can target achieving the United Nations Sustainable Development Goals.